The shoes that you wear could be making your knee pain worse without you even realizing it. So the research consistently shows that if you wear a shoe where your heel is positioned higher than your toes, that will increase the demand, increase the stress through your knee as you walk. And you can see that in the image here, a flat shoe would be where the heel and the toes are positioned at the same level. And as we increase the heel position relative to the toes, that would reflect a higher heel to toe drop. So how do we use this information? The first step is awareness. So if you have increased knee pain when you walk or after you walk and you don't know why, the first step is understanding your footwear. So if you actually have a shoe where your heel is positioned higher than the toes, you might want to begin gradually bringing that heel down to a flatter shoe to actually increase that demand on the ankle. That's how it works when you have a higher heel relative to the toes. It reduces the workload on the ankle and foot and increases the workload on the knee and can make your knee much more painful. And the second important reason here is that if you're not aware of this and let's say you're working with a therapist to try and reduce your pain and the therapist is giving you exercises to help reduce your pain, but you're not finding those exercises helpful, it may be because in other activities like walking, for example, if you're wearing a higher heel to toe drop shoe where the heel is higher than the toes, and that's irritating your knee every time you walk and you feel like your knee is flared up afterwards, that could be the reason you're not responding to the exercises that your therapist is giving you. So walking in a higher heel to toe drop shoe could be picking the scab constantly and not giving the knee a chance to settle down so that it can respond better to the exercises that your therapist is giving you.